highlighted, expressed. India, more than any other country, because of its tropical climate, is more vulnerable than many other countries and regions. One of the key effects would be probably on human health and also on the economy. Our cities particularly are more vulnerable than our rural areas. And there are numerous studies and statistics now that have come out, which are giving us the scale and magnitude of what the impact would be. Just to share some statistics by International Labour Organization, World Bank, and other leading institutions suggest that the impact on the economy could be as much as a 5% GDP loss. And the fatalities from heat stress could increase fivefold. And this could be a major public health challenge given the aging population that we might have by the turn of this century. And unless we do take countermeasures to both mitigate climate change and make our cities more resilient, we could see the extreme heat days, which is temperatures exceeding 50 degrees Celsius in continuity, might actually exceed 100 days in any given year. So the scale of this challenge for Indian cities is particularly enormous, and we have to deal with that. Another reason that one has to tackle heat resilience in cities is that cooling, one of the solutions to counteract heat, is predominantly energy intensive right now. And quite a large percentage of our population is unable to access these cooling devices. So it becomes all the more imperative for India to plan for heat resilience. Cities particularly face more acute heat because of the way they are being designed. And we are going to deep dive into that during this session. We're also going to look at the impact of extreme heat on human health and also how to plan resilience around it. We have three eminent experts with us today who have probably devoted nearly 2 decades each to study the impact of heat stress and then solutions to resist its worst impact. I'm going to introduce all of them before we start the discussions. Dr. Umamaheshwaran Rajasekar is an advisor to Coalition for Disaster Resilient Infrastructure. He has over 2 decades of experience developing policies with efforts towards mainstreaming building urban resilience with governments, NGOs, and multilateral agencies. He's closely associated with National Institute of Urban Affairs. He was the chair for Urban Resilience Unit in NIUA and MAHUA, and he started the Climate Center for the Center for Cities in NIUA, and is doing sterling work right now. Welcome, Dr. Rajasekar. Our next panelist is Dr. Purvi Patel, who is a senior consultant at the National Center for Disease Control, Ministry of Health and Family Welfare, Government of India. She is working for the program with a specific focus on the health sector response to impacts of extreme heat and other extreme weather events. Dr. Patel oversees heat health surveillance and contributes to the development of state action plans on climate change and human health. She again has decades of experience in public health and clinical research, gained while working with IIM Ahmedabad and the Johns Hopkins Medical Institute, United States of America. Last but not the least of these panelists is Ms. Minni Sastry, who advises United Nations Environment Program on extreme heat planning. Minni Sastry has over 19 years of experience in design and research of climate responsive buildings, heat mitigation policies, and developing standards for sustainable urban development. Minni has been closely associated with TERI, which is one of India's leading think tank for sustainable built environment for more than 13 years now, and has led multiple studies to analyze urban heat island effects and resolving them. So welcome, Minni, Dr. Patel, and Dr. Rajasekar. Minni, I'm going to start with you probably. The first question is going to be posed to you. If you could tell our audience, based on all the work that you have done so far, why do cities experience more acute heat? What are urban heat islands? And how do we analyze the extent of heat in cities? Over to you.
Thanks, Aarti, for the introduction and for inviting on this platform to share my work. So if you're okay, I could share a screen and yeah.
Definitely, please go ahead.
I have a presentation which would help. So as you said that, yes, I hope the presentation is visible. Okay, so as you said, yes, the cities are being warmer in the past, especially 30 to 40 years now. We are observing a trend of warmer cities. When we say urban heat island, these are islands of warmer temperature. So pockets of cities experience warmer temperature in comparison to the outskirts or the rural areas. That's why we call as urban heat islands. Now, and it is one of the most visible act of human activity, the way we are planning our cities, the way the urbanization is happening. That is the major cause of increase in air temperatures as well as surface temperatures of our cities. So what are the critical causes? Now, besides climate, which is not in our hands, when I say climate, meaning, day and time, night temperature differences or seasonal differences that happen from summer to winters, there are other factors which are human interventions, urbanization and the way urbanization is happening, which is the major cause of increase in the temperature of cities and variation of temperatures in the city. One of the major causes which has been observed is reduction in green infrastructure. Reduced cutting of trees and giving way to built up area, increase in the built up area in cities. When we look at the land use, land cover plans, looking at the trend of last 20 to 30 years, most of the cities which are growing in the country have reduced their green cover, their open lands, the water bodies have reduced, the lakes in the cities have reduced, and given way for land for the built up areas. So what happens is that, because of reduced green cover and reduced water bodies in our cities, the evapotranspiration rate, which helps in maintaining a good microclimate, reduces. Hence, making cities warmer. Not only that, more and more hard surfaces, concrete surfaces, reduction in soft surfaces or porous materials, they absorb more heat, retain more heat and emit back more heat. Dense developments with narrow streets could shade during the day, but they capture heat and retain heat inside. So typically dense developments, if we look at slum developments or very dense developments in cities, commercial business centers, which are very densely developed, we see them as hotspots because heat is not able to it's not being able to re-emit back to the sky, which is a heat sink. Also surfaces, so the materials that we use in our cities, in our buildings, black tarred roads, unshaded buildings, concrete, dark surfaces, we see the surface temperatures of these increasing, and which causes, those pockets having higher temperatures. And another major cause of urban heat island, besides green cover reduction and water bodies reduction, is the anthropogenic heat from our buildings and from vehicles. So buildings, though we air condition them to maintain cool inside, but we throw out the heat to the atmosphere, as well as we see that where there is more congestion, more traffic, more private vehicles used, the pollution and heat emitted from vehicles are a cause of rising increase of temperatures in cities.
Minni, I remember some time back, when we met, I you informed me about this study that you had probably done in Bangalore on the differences in temperature. Could you share with us what were the observations there?
Sure. Sure. Yeah, so okay, so before I share that, it's important for me to also inform that when we are looking at urban heat talent, we are looking at two ways we can define urban heat talent, or two ways we can analyze urban heat talents. One is atmospheric urban heat talent, where we study the difference in air temperatures in various pockets of the city. The second way of analyzing urban heat talent is through surface urban heat talent analysis, where we understand the land surface temperature, how the surface temperature of the land is differing, from pocket to pocket, from neighborhood to neighborhood. And when we look at atmospheric UHI analysis, we are looking at, scientists have defined various layers in the atmosphere. I'll be very specific. We are looking at the urban canopy layer, which is the layer of atmosphere, the layer of air which is around our buildings. So we study air temperatures inside the urban canopy. Now, with this as a background, we started these studies in TERI Bangalore in the early 2010, 2013, and did till 2019. Where there were studies also carried out by Indian Institute of Sciences, where we were looking at how Bangalore's land use, land cover has changed from 1970s till 2020s, where the greens and the blue landscape of Bangalore has been diminishing, giving way for the more and more built-up area. So these maps, of course, are available and are, of course, we have the capacities of developing these maps. Besides these, also what I see is a capacity which needs to be developed is that along with these LULC maps, we also have what you see on the right side, the land surface temperature maps, or LST maps that we say, which help us understand UHI in cities and identifying hotspots in cities. So if I can generate an LULC map from 1973 to 2020, 2022, I can also generate land surface temperature maps, which can be generated, which is data obtained from satellites. So from these land surface temperature maps, we can identify hotspots and we can do field measurements to understand, how in certain pockets of a city, what is going wrong, or, what are those urban parameters which are causing increase in temperatures. And so we had done this study where we had taken about 6 locations in Bangalore in various parts based upon different LULC pattern. And what it surprised us that, even so, this is now showing that was surface temperature, this is showing air temperatures. So we can monitor atmospheric UHI by monitoring on different spots in the city at the same time spontaneously. And what surprised us was a temperature difference of 7 degrees Celsius between Indian Institute of Science, which everybody is aware is a green campus, very well planted, in comparison to Electronic City, which had minimum green infrastructure and most unshaded, exposed to solar radiation surfaces. So there was a 7 degrees Celsius difference on a peak summer day in April when we had done the monitoring in Bangalore, 7 degrees Celsius during the daytime, which is at 3 p.m. and during the night time. So UHI, the urban heat islands, are also measured during the night time. In the night time, what you see, the lowest is Kodati, which is the outskirts of Bangalore. So the outskirts of Bangalore, or cities where there are open lands, green surfaces, they can release back the heat quickly. While Commercial Street, which is the commercial hub of Bangalore, which is very densely developed, was still 4 or 5 degrees Celsius warmer than the outskirts of Bangalore.
Okay. Thank you so much, Minni, for running us through such a visual presentation on the effect of urban heat islands. Dr. Purvi, I believe the Ministry of Health and Family Welfare, through its multiple programs, including the one that you're a part of, is leading research on the impact of heat stress on health and across different demographics. Uh, so how does, based on your studies and research across all these years, could you tell us how does extreme heat affect human health and productivity? And is there any variation in vulnerability to heat? And is that variation itself influenced by our physical surroundings, that is, the parts of cities that we live in? For example, living in highly dense areas versus living in low density areas, what effect does it?
Okay, that's a great question. First of all, thank you for inviting me in this afternoon. Good afternoon, everyone. So if you allow me, I'll just present a short presentation and elaborate later on after the presentation. Is that okay?
Yes, yeah, I think we can definitely.
Okay, just let me share my screen. Okay, so heat has many different impacts on our health. Some of them are more understandable, and some of them are coming out of the research. So as you know, normal body temperature ranges in very narrow range of 36.8 plus and minus 0.4. And any temperature beyond this range will make us uncomfortable and reduce our productivity. So if we talk about direct impact of heat and heat-related illnesses, there is a range of illnesses ranging from mild, that is like prickly heat or heat edema, to very severe form of heat, that is heat exhaustion. And if it is not controlled, heat stroke. Heat stroke is the most fatal form of heat impact, where the brain is affected, because brain is the organ very sensitive to heat. And when it stops functioning, it is like equivalent to a stroke. That is why it is called heat stroke. Many times the fatality also occurs because the patient do not get cooled down immediately. So the delay in treating them also, affects them. And there are long-term impacts also reported after heat stroke, even recovered. So there are long and short-term impacts of heat. If we talk about vulnerable populations, if you see classic heat stroke and exertional heat stroke, there are two different populations that are vulnerable to it. So in classic, there is those are the people who are not able to maintain their thermal regulations, mainly children, elderly, chronically ill, and long periods of heat impact them differently. And with high humidity, they are more vulnerable to get heat stroke because of their physiological maladaptation. And in exertional heat stroke, the people are usually healthy. They are actually exercising or working outdoors, but their exposure is severe enough to cause the decompensation in their temperature regulation. And they can, if they not get cooled down, they develop exertional heat stroke. We mainly hear about exertional heat stroke, and very easy to picturize the exertional heat stroke: person staying outdoors and then developing it due to reasons. But if the exposure to heat is severe enough, even healthy people can succumb to heat stroke. I just want to remind the classic one, the epidemic form of heat stroke. It usually occurs in the heat wave situations like you see in UP, Bihar, and it was also reported in the large degree of deaths that were reported in France in 2003. So this is very common form of heat stroke when severe heat waves are there. So vulnerable people and elderly people are more affected. Even people who are lonely, they have socially isolated people living on the top floors of the buildings are more affected during the heat wave conditions. There are certain things that we should know. So apart from these heat impacts, how the heat affects our body is that there are physiological adaptations. So one short-term physiological adaptation is called acclimatization, which occurs when we are exposed to heat over the time gradually on the over 10 or 15 days of time. So in the early summer time, we all get exposed to heat and our body usually adapts to the increasing heat and develops a different level of perspiration mechanism. So this physiological adaptation helps us tolerate heat more and more. So if you see a tourist, people who are having comorbidities, or people always in air conditioning have less of this kind of adaptation, and they are more vulnerable to getting heat-related illnesses. Historically, also people who are living in colder regions and they suddenly see the higher difference in the temperature due to global warming and other reasons, they are also susceptible to heat-related illnesses. Another is accumulation of heat stroke. So over the long-term exposure, and especially when we talk about urban heat island effect, when the nights are not cool at the night, there is no cooling at the night time, our body accumulates those heat stress over time. And with lack of power or cooling or water, this can result in heat-related illnesses. This can also happen at persistent moderately hot temperature with humidity. So the equation is like that: if temperatures are around 35, but the humidity is 70%, then those temperatures also feel like 52 to us. And so our body fails to perspire and heats up. So these are sort of heat stress developing mechanism. When the heat stress goes beyond the body's compensatory mechanism, we develop heat-related illnesses. Another important aspects, I'm just explaining here to mortality displacement, because the general perception when I meet people, when I meet also to the health officers, is that heat does only occur after heat waves are announced, but it is not true. So heat impacts occurs even before the heat wave starts. So many times it is observed in the cities that many deaths occur in the early part of summer, because only already frail and sick people will not tolerate even moderate amount of heat, and they will those mortalities are reported in those situations. So physiologically, there are like 27 different pathways that heat impacts us. There are organs like brain, heart, intestine, kidney, liver, lungs. These are affected through different physiological mechanisms like ischemia or heat toxicity, inflammation. And together, they develop, the end result will be some sort of heat-related illness or heat stroke, but it goes through a different, combination of uh, pathways and things. So it's not always heat stroke. So when we hear about death due to heat, is not always heat related, not always heat stroke, but these are other mechanisms that are also playing, and they are visible as cardiovascular deaths. So cardiovascular deaths are some of the major cause of deaths during heat season, and it's not the heat stroke. The following that will be respiratory, because air pollution will be also high, like ozone levels are higher. Heat itself affects our lung cells, and also dust pollution is there. So following cardiovascular, respiratory causes are the second most common cause of death in heat, and also then followed by kidney disease. So we see all cause death that increases, and we at the health sector, we try to understand and see the distribution of all cause mortality with temperature. So heat stroke is just a tip of an iceberg of health impact of heat. There are multiple effects. And if we see other impacts in heat, there are due to accelerated death that I mentioned, then increased hospitalization, and then potential disruption of power, water, transport productivity, increase in foodborne and waterborne disease that we also know, a drowning due to people, approaching water bodies, work-related injuries, and impact on health services that, overburdens the health services in terms of the response and other things. And concurrently, there might be air pollution, drought, and fires, urban fires, and wildfires are also affecting our health. So that was the short presentation, but I just want to make few more points that uh, other than physiological conditions, now that we are understanding pregnant women are also vulnerable, so each 1 degree temperature increase is associated with reduced birth weight and risk of preterm births and stillbirths. So these were the individual level factors I mentioned. And the population level, we see that each city has a different level of physiological adaptation. So there was a study done in 2019 where that identified the temperature at which mortality increased in Ahmedabad and increase in Varanasi. And they found that in Ahmedabad, the temperatures are much higher for increase in mortality, where Varanasi, the mortality started happening at a lower level of temperature. So these are the site-specific physiological adaptation, long-term adaptation that people have, that they protect them or they make them vulnerable to the heat impact. If we talk about specifically built environment, they definitely affect us, like buildings, trees, open urban spaces, infrastructure. And with urban heat island, the effect is multiplied of the surrounding that we stay. So if I mention a study which was done in Calcutta, they found that indoor heat index level in urban slums were around 5 degree higher than the outdoor during summer, outdoor temperatures during the summer. And those dangerously high temperature and humidity remained there for 9 hours in a day in urban slum dwellings compared to 2 hours in a day in rural houses. So there is definitely an impact of our urban environment, cemented walls or clay tiles and tin roofs and fewer rooms, crowding in smaller houses, all make them vulnerable to get heat-related illnesses. High night temperature is also coming up as a very significant predictor of heat-related illnesses and mortality. Many cities have now shown their in their research that is the case. And lastly, I want to say, because I've seen a lot of, I have met health officers and seen some of the, like Mumbai and UP and Bihar. I think it is important to say that heat is very unique as a hazard. It has no the theatrics or display of other extreme weather events. It is not well defined in objective characteristics. So the vulnerable population, one we think conventionally, that is also there. But the new vulnerable groups are emerging as heat is intensifying and the duration is increasing for India. But ultimately, it comes down to how conditions transpire at the moment when the heat stress become uncompensated for somebody. What kind of institutional measures are in place, how much access that person has to these measures, and what kind of behaviors that person adopts. That is more important. And that is why at one point of time, everybody of us may be vulnerable. And that is why preparedness is very important.
Thank you, Dr. Purvi. Mahesh, Dr. Rajasekar, Purvi and Minni have outlined the impact and the causes of it. With your extensive experience, you have been part of so many frameworks, international and domestic, that have been developed to build resilience. And your experience with MAHUA and IUA and now CDRI. What are the approaches and planning processes that you would recommend for developing urban heat resilience, and especially in the context of India?
Sure. Thank you, Aarti, and thanks to NIUA for organizing, in collaboration with UNEP, for organizing this wonderful conference. It's very important for us to start talking about heat. I think while everybody has been experiencing it for a decade or 2 decades now, I think the conversation around heat and heat-related impacts have been quite limited. And what we have started doing is trying to identify or map out the landscape of what is actually happening with respect to infrastructure. So just to give you some key statistics or numbers, if no adaptation measures are being taken, the grounding of aircrafts currently happen at a scale of 500. This I'm talking about the key 100 plus airports across the world. And this number is going to be increasing by 4x. And also, in terms of, we saw recent incident in Odisha in India, the derailment of trains, but there is also globally evidence that the impact of heat has also started affecting the railway tracks. And so there is a projection that if we, for every, degree centigrade increase, the life of the rail infrastructure comes down drastically. And in case of transformer, that comes down by 4 years for every 1 centigrade increase in temperature. And the output of transformers decrease by 1%, for every 1 centigrade increase in temperature. So there is quite a lot of impact which also happens on water supply, water resources, which we have seen. And in India, if you just go around, travel around on the roads, you see the melting of roads, the bitumen, which happens during peak summer. And if that is followed by a shower, a monsoon shower, or if that is followed by somebody pouring water onto these bitumen surfaces, it leads to cracking, and also it leads to damage in that road infrastructure over a period of time. And that brings down the life by over 5 years. It brings down the life by half, literally. So the issues are complex when you get into institutions and systems like schools, hospitals. It becomes even more complex. The healthcare cost increases tremendously, especially patients who have been admitted to public hospitals. The caregivers are more stressed in catering to these people during times of heat, and they are not able to bring down the temperature internally. The cooling mechanism doesn't exist in many of the public hospitals in majority of the spaces. Of course, there are some in ICUs, but that is not the case in majority of the places. And also, in schools, of course, we encourage kids to play, but in India, the summer time extending over a considerable number of months, 1/3 of the year, I think that reduces the ability of letting children going out and playing in outdoor environments. So there are a lot of direct impacts, and there is also social impacts which needs to be considered. And what can be done? Of course, there are a lot of things which can be done when it comes to urban heat resilience. First of all, we have to start thinking about it holistically than sectorally, because urban spaces are a bit more complex. We can't start working in silos to come up with a heat resilience strategy. Similar to water, there are multiple institutions which are affected. There are differential impacts, and the planning and designing needs to be integrated. Second, we should move away from the master planning efforts, because master planning, even though there is a value in intervening and providing inputs, similar to what the previous speakers have spoken, there is a value in including LST within the master plan. That may be a starting point. There may be a value in also considering a certain amount of green spaces around critical infrastructure, especially the healthcare and schools and so on and so forth. Changing the URDPFI guidelines to include heat may be one of it, because the URDPFI guidelines right now doesn't talk about heat in specific. I think including a chapter in that is going to make a difference. That goes also for the model building bylaws. The model building bylaws, which was recently introduced in 2017 by the Ministry of Housing and Urban Affairs, doesn't consider heat as a critical impact. They have brought in fire safety standards, which is a very good improvement and advancement from the previous one, but it is also important to include heat as a critical disaster. Now, I would say that not only heat, but also flood. In urban areas, these both go hand in hand. The same imperviousness which leads to flooding also leads to increased, urban heat. So looking at these two things, same trees, planting of trees is going to bring down the temperature, but it is also going to help in reducing the runoff. So looking at these co-benefits is going to be very important. Rather than just a solution for heat, it has to be looked at in a multi sectoral perspective. Same goes for we found that open spaces, green spaces makes a lot of difference in handling issues such as COVID. That's very much needed for people to move around and also spend time with their family and near and dear ones, and that has a huge impact on both mental health and also physical health. So considering all these things together makes a lot of difference. The second aspect which also needs to be done is better monitoring. Even though in India over the recent past there has been an increased monitoring of heat. I think this is temperature sensors are one of the cheapest sensors which are available when you consider IoTs, and you don't need any complex monitoring. People can have a thermometer in their house, a simple thermometer in their house, which can help measure it and share that information in some form. And most of the devices, I think even I come across water bottles, which was given in COP27, had the temperature measurement devices within it. But unfortunately, the extent of monitoring to identify the differential indoor heat and the outdoor heat, and also heat across various spaces, even though LST can provide certain things. But I think increasing the monitoring of it. In LST, the problem with that is you can't measure the diurnal temperature difference. Of course, there are satellites which can help you do that, but they are very low resolution. It doesn't work in urban spaces. It works at a regional level and a district level. So increasing the monitoring through combined collaborative efforts is going to make a lot of difference, and it's going to benefit us to target interventions. increasing the green infrastructure. Of course, our URDPFI also indicates that 15% of urban areas should be green. But the CSEAF assessment 2.0 clearly indicates that out of 126 cities, hardly 35 cities do adhere to the guidelines or do have 15% of green spaces, And many a times what is happening, at least in the Indian context, is people are going around the planting initiatives, the planting drives by mayors, by commissioners, by, famous personality, which is a good thing. But unfortunately, they don't care about the operation, the monitoring of these plants over the 3-year period. It becomes a one-off initiative, and when people come off and, the cows and the goats have a good, nice meal the very next day, and these plants do not survive. And they end up planting in spaces which are already green. They go identify a park or identify an, forested area. But we need targeted intervention, and we need to identify solutions. That's where we need to engage the community in spaces which are hot, in spaces which are very difficult to identify green areas. That's the area where we need to go and see how we can deconcretize some of the, pavements. How can we deconcretize some of the areas within residential communities, neighborhoods? How can we create space for trees to grow? And trees like Ashoka and, date palm and things like that can grow in a very small area. They are not deep rooted. They don't affect the drainage and the water supply system. Identifying certain native plants which don't affect the service or their other infrastructure, but still can provide that small respite. We need to do that rather than going with this 1 million trees. We need to identify these critical hotspots and encourage people to, green these hotspots in some ways. There is a wonderful initiative which was brought about in Paris, where the schools took an initiative that they will reduce the impervious surfaces by X percentage. And every school came up with their own target, and they were competing with each other to beat. So they were deconcretizing places and planting grass, green spaces, so children can play. It's also helpful for that. And during heat waves, people in that neighborhood can also come and use that space within that school. So it has a duality to it. And of course, you can also motivate public in that community to start maintaining it, which will also reduce the cost on municipal corporation for O&M. Of course, there are other things like water management, and there are community engagement which can be done, and things like enhancing the energy systems. I think there is an increased load on grids and substations during these heat waves, and I think there is a value in us working towards how do we, some of the states have already been progressive to have grid connected solar PVs, So encouraging and motivating that is going to also help the excess load which is going to emerge, because the more the heat is, the more the load, because now many people have moved towards air conditioner, and how do we reduce that to prevent power outages? I think connecting the excess, and that's also the time when you have excess or the maximum potential this solar PVs can provide. So how can we capitalize on that is going to be key things. Transportation system, we don't have warnings. I think Delhi Metro has started in India to provide advisories during heat waves, but that is only for the train operators. They say that they have to stop the train if the temperature exceeds a certain threshold. But there is a value in moving forward and looking at it to informing people, using metros, using public transportation systems, and also for bus operators. It is the time when the rubber, the tires do damage quite significantly. And these are the time I think we need to come up with infrastructure specific warning to help people take informed decision. It's not that we go about changing their lifestyle, but they can always take informed decision. People driving their own cars can take their own decision, that we won't drive during these times. And right now, there is also value, I think, in looking at community engagement and also looking at insurance mechanism. One of the recent ones that the Mahila Housing Trust, and also the Seva, in collaboration with a few of the insurance companies in US, and also with support from Atlantic Council, have come up with a parametric insurance for women workers during peak summers. That parametric insurance is the easiest one which one can roll out to augment, the support one can provide to the community, especially during these heat waves. And like I said, it's one of the easiest thing to monitor. Once they do that, at least we can protect the livelihood of people. Because one way, at one hand, we are saying that people should not go out work during extreme heat wave, or they are suffering out of it. The other thing is also the livelihood. If they don't do that, they don't get paid for the day. They can't have their night meal, so it's very complex situation. We have to look at it from either side. And it's also the loss to, if given that out of 365 days, we are experiencing pretty much heat 1/3 of the day. And if you tell the builders, tell the engineers, tell these operators like Zomato's and Swiggy's not to do that, it's going to be a huge, severe loss of business for them. And India will stand still. So we need to come up with these kinds of insurance which can protect the livelihood to a certain degree, at least when the temperature exceeds certain levels. Also, that can help in giving them the healthcare cost, the necessary healthcare cost. And that can also enable increasing, I think Dr. Patel did talk about the increase in morbidity during these heat waves. How do we measure it? So when we have these insurance, people go with this insurance, and that's when we start measuring the morbidity. I think mortality is the most easiest thing, but I think that's an easy step to achieve by changing the state regulations and also the disaster preparedness plan. But I'll stop here. There's a lot more to be done. And like I said, it's very, very glad that this conversation started taking place and more people are engaging in it. Over to you, Aarti.
Thank you, Dr. Rajasekar. I completely agree with you. And there's a shocking statistic that while URDPFI suggests a minimum per capita green cover of 10 square meter, and this green cover actually is basically open spaces, which could include paved areas, not exactly green. Indian metropolises are not even able to offer about 2 to its citizens, and other cities, basically the tier 2 and 3, fare slightly better. Not to. So I completely agree with you on all of these points. My second question, and I'm going to again pose a direct question to you. I think Minni and Purvi will have to wait. Based on your experience in working with these cities and building heat resilience, not just to heat, but all other climate-induced possible disasters, where do you think is the challenge for them? The biggest challenges, and in brief, what would be the national policies that would support them to overcome these challenges? And these could be institutional or technical capacity, based on your experience. Could you hear me, Dr. Rajasekar?
Can you come back on the question, Aarti? Sorry.
Sorry, yeah. So the question is, CDRI and even while you were there, I've been working with cities to help them develop capacities for risk resilience, disaster risk resilience, including heat. And based on your work with these cities, what do you think are the biggest challenges for cities to have heat resilient infrastructure? What are the biggest challenges, and what could be done at the national level, and what is already being done?
I think the heat, one of the biggest challenge for addressing heat is because it's a so slow onset event. So there is this famous quote of a frog in a pot, right, of hot water. If you put it in a hot water, it will jump out. But if you have the frog and slowly heat the water, its ability to jump out is limited. And that's the same case with heat for us. It's a slow onset. People think, chalta hai, let's manage it. We will try to overcome it. We will have some quick fix solutions here and there. And they don't look at it as a disaster. So the biggest challenge is looking at heat as a disaster. Right now it's being looked as a stress. So how do we move from, and there are protocols to it. Why I say that is, except for Odisha, none of the states in India has recognized heat as a disaster. So until unless the states do not recognize it, it won't come into the planning, guidelines, at least the city and town planning guidelines at the state level. Even though you can bring it within the national level, many of the cities need to adhere to also their state guidelines. So it's important for that to happen. They recognize heat as a disaster. Second thing, biggest challenge is also our documentation of heat-related impact. While I do quote a few, it is at a very, very early stage. Over the last 23 years, I think the 20 years have been the hottest, and we have been breaking the record year after year. And the most affected are the urban areas. And right now, if you go and look in terms of the literature, documenting some of the loss and damage which has occurred to heat, it's very negligible compared to the extent of loss and damage you see in terms of cyclones, see in terms of other bigger disaster. Even for drought, it's very less. We get the data from the direct loss and damage which occurs to crop from the revenue department. But if you look at urban heat per se, it's actually negligible. We don't have the mortality or a morbidity rate, except for some cities, which has documented. We don't have the kind of impact it has on the infrastructure. And many a times these smaller areas, like I said, the bitumen in the road melting or certain infrastructure melting, people feeling discomfort, those are, and I think especially the productivity loss, these are all not measured across the world. And in India, it is even more less. I think, how do we start documenting these impacts? Once we start surfacing the extent of impact, people will also start investing around it. If you don't do that, then their ability or the intent to invest decreases proportionately. And the fourth thing is also the insurance mechanism. How do we bring insurance, especially when it comes to infrastructure? So heat, even when it comes to some of these commercial insurance, it's not considered as act of God. So your systems may fail in the house, your life of infrastructure may come down, but still it's not considered as act of God under the insurance. It's only those big disasters are, like I said, earthquakes, landslides, cyclones. So how do we change that? Once again, that can only happen through evidence. And I think heat as a subject needs to be taught, and the prevention precaution in all measures. Heat should be elective, at least within certain, streams, architecture, planning, building sciences, and so on and so forth. I'm sure it's there in the health. People do, I think, have quite a bit to handle the health related things. But in terms of engineering planning, we don't talk about heat, So how do we bring that as a part of a curriculum? That should be the key to bring about these transitions.
Thank you, Dr. Rajasekar. I'll continue on that, line of questioning with Minni and Purvi. Dr. Rajasekar mentioned we just don't have the documentation and the monitoring to analyze the heat and its impact. So to both of you, Minni and Purvi, if you could tell us, one of you is an expert on heat mapping and analysis, like how do we scale it up? I think to the best of my knowledge, only about 10 to 15 cities have done any kind of heat mapping. So how do we scale that up, make it possible for cities with whatever resources they have currently, and maybe some supplemented resources to do that? And Dr. Patel, I think just continuing with that line is that, we have not been able to map the vulnerability of the populations in a particular city. And if we don't have that, as Dr. Rajasekar said, have to plan according to what is the problem. And in this case, we are not able to analyze heat. So if one is to map the vulnerable area so that they could get more emphasized attention, in terms of heat resilience planning and solutions, then how do we go about that? What are the options for the cities? What is the kind of data that the cities must start accumulating right now so that they're able to do that in the next few years before this becomes a problem of unmanageable proportions?
Yeah, Aarti, if I could, respond to that. So firstly, I think, and I am, in alignment and in agreement with a lot of things with Dr. Mahesh said. And so it's very, very important that the city officials, our cities, are aware of the data which is already available. It has to be data driven. Unless we know, which are the hot pockets, for example, it is difficult for us to have mitigation strategies, implementing. So it is important to raise awareness amongst city officials, amongst the disaster management authorities which are there in cities, their officials, knowing that data. When I say data, what I mean is that both ISRO, we have been in touch with ISRO for some of the research works there. The data is available for air temperatures, 30-meter resolution. Yeah, 30-meter resolution. They have data for air temperatures, so to quantify atmospheric UHI. And we have been gathering data from the USGS Earth Explorer, also 30-meter resolution land surface temperature maps. So it's very important, I think, to first of all bring this awareness to to the officials who are responsible for generating heat mitigation plans, that this is reliable data and most of it free of cost is available. Then I think it is important to have capacities to analyze data. See, we have the data, but when I talk to ISRO also, we don't have people to analyze the data. So it's important that there are teams who have the capacity, for example, basic capacities of GIS platform analysis to analyze the data which is there. Because if we have the capacities, the data is already there. We need to build capacities in the team who can analyze this data, every city. I think then it's an easy and a smooth path, because every city, and I don't see that happening, in any of the action plans that I have seen, that there are UHI maps. UHI maps can be made available with the existing data that we have, but I do not see the UHI maps part of these heat action plans. So, once we have UHI maps, which could be depicted as simple as LST or through air temperatures, it's easy then to identify, which are the areas in a city which need attention, where temperatures are expected to be higher than, 40, 45 beyond normal, and implement mitigation. I also agree with Dr. Mahesh on, the part that communities, can take part. And especially monitoring of, air temperatures, monitoring of RH is something which is economically viable. We see, for example, we see on our traffic lights, right? We have cameras already integrated. So one could definitely look at ways of involving community, involving the existing infrastructure, and monitoring air temperatures, in these critical areas, and then accordingly plan.
Thank you so much.
I have some visuals.
I'm sorry.
I have some visuals. No, I'm saying I have some visuals for some maps, but I think the time may not permit me to show.
Yeah, I'm really sorry. Dr. Patel,
Yes.
vulnerability assessment, I think it's very critical that we overlap heat maps with the vulnerable populations to get a picture of how the city is being impacted in there. So your take on that?
Yes. So first of all, I would like to answer about the heat-related data collection. So as health sector in National Program on Climate Change and Human Health, we have put on an effort to collect data for heat-related illnesses, where we focus on suspected heat stroke cases and deaths. And also emergency admissions, like total emergency admissions, and all deaths and cardiovascular deaths that are happening every day in the facility. So as I elaborated earlier, it's not just heat stroke death, but we are trying to understand which temperature, how the trends of admissions and deaths change with the temperature daily. So that is an effort that we have started and which is been digitalized this year. So from this year, all the facilities, PHCs and above in the public health sector are to report all these parameters daily in the summer season. So that is an effort, but it requires a lot of understanding as part of health officials, a lot of awareness and sensitization in identifying the cases and reporting in Delhi. So that's a big, it's a good initiative, but it requires a lot of effort. If I go to and talk about vulnerability assessment, it's a very, as far as I understand, when we set out to measure health vulnerabilities, in particular to some hazards or particular to particular disease like dengue or any other disease that are affected by climate change and which are supposed to increase in India. So identify that those are the very data intensive processes. They take time, that require statistical understanding and analysis. And so because it takes time, what we include in that vulnerability assessment is very important. What is readily available there, as Minni ji already said, that is more to be focused. Otherwise, there are like 20, 30 indicators that you can come up with and try to set out to do a vulnerability assessment. But again, we need to remember that it should be repeated. This process should be repeated so we understand how our actions are making the difference. So based on that, I think for heat, the cities like Jodhpur, they have done some simple understanding of parameters like land use, land cover, meteorological parameters that are readily available, maybe maximum temperature or temperature differences or nighttime temperature are easily available from meteorological department or ISRO, other parameters, health facility access, and some of the measures of socio-demographics like population densities which are available can be used to understand the vulnerable areas and hotspots. And again, I want to say that you can validate the outcomes of the assessment with the health related illness that are reported in that area, so that can be used to validate your vulnerability assessment and also understand the health outcome. But again, to reiterate, lack of vulnerability assessment should not stop us from preparing. That is what my observation is. Many times these assessments go wrong and they do not appeal to common knowledge. So we have to be very careful about what we select, how it comes out, how it gets validated, and how it is implemented.
That's quite an insight. I mean, I think the general understanding is that vulnerability assessments are quite critical to applying solutions for heat mitigation.
Yeah, they are critical, but sometimes when basic facilities are not available, I think the first is to build that, finish that gap, and then you think about vulnerability assessment. Without bridging that gap that is already existing, I think waiting for vulnerability assessment is not something that we should do. That's what I have observed.
Thank you. Dr. Rajasekar, I'm going to move to you for probably the last question from my side, and there are questions lined up from the audience, so let's see if we have the time to address those. You mentioned insurance, as a mechanism, and to the best of my knowledge, from what I understood, that's an individual's countermeasure, so to say. And there's a question also from the audience about this. I would like to know, are there any other financing mechanisms, especially to developing the physical infrastructure which can resist extreme heat?
There are some, but very, very few. I think, there are few which are come under, packaged in risk pooling mechanisms, where you have it as a part of the overall risk strategy, and but not specifically for heat related. And like I said, insurance industry works based on data, So if you look at many of the models, risk models, which these insurance and reinsurance companies run, they don't include heat.